Hello again, everybody, and welcome along to another one of these interview sessions with me, Ben Calder, for the Bowen Therapy Professional Association, the BTPA. And I'm really excited today, hot after a day of teaching over in Kent, to have Phil Steward join me from assessment-led bodywork training. Now, Phil's based down in Broughton and Devon and has a wonderful history within physical therapy, having trained with the Oxford School of Massage and the Northern Institute of Sports Therapy, having trained in Ayurvedic massage as well as advanced manipulation therapy, all along with the Bowen. And he's worked with some of the fabulous Bowen teachers over time. So I'm really, really grateful for Phil taking time out of his training schedule today to join me for this interview. So Phil, thanks for coming in today.
So welcome, Ben. Thanks for inviting me and having me. I only hope my brain is working after teaching all day. It's somewhat befuddled, so we'll see how it
Well,
goes.
absolutely, yeah, sure. And hopefully as well, my questions will be of stimulating and interest enough that I won't just sound like one of the
Don't make
students
it too
today.
hard to
And
confuse me.
yeah, we'll see how we get on with that. So for anybody that hasn't come across you and your work yet, just tell us a little bit about how you got to where you are today, how you got involved in physical therapy, and what your introduction into Bowen was.
Okay. So long story short, all I wanted to be when I was a kid was a professional cricketer. Broke my back when I was about 16 from playing cricket. Had
Wow.
surgery when I was 18. Then by the time I was 20, I realised I could no longer play cricket. Basically got to the stage where I had had back surgery, went to surgeons. I literally couldn't walk. You know, when you treat somebody and their back's gone and they can hardly move? Well, that was me. And I basically went to the surgeons in Oxford, and they looked at me basically gave me a big bottle of pills and said, nothing more we can do for you. You don't really understand how everything works. Here's loads of painkillers. Here's loads of antidepressants. Make the most of your life. You'll probably be in a wheelchair by the time you're 30.
Wow.
So I went home and I sulked for about a week. And then I thought, nah, sod this. There's got to be a way around it. So from there, that's where my journey into healing began. And I started my journey into healing out of self-preservation and out of wanting to fix myself and heal myself. And that's how it all began. And I wanted to work as a healer. And I figured out the best way I could do it was hide it within massage. So then I went and learned massage. So that was how I got into my healing journey and how the ball started rolling, so to speak. So did various different massages, and as you said, I went and studied Ayurvedic massage in India, and then I did an advanced manipulative diploma, which was basically same manipulations as osteopathy, the same kind of work and the sort of theories as osteopathy, taught by osteopaths, but basically you couldn't call yourself an osteopath. So I did that, and then after that, so I've been working all these years, and then I kept finding myself working on these same areas of the body time and time again. And for some reason, as life works that way, Bowen therapy kept popping up. Everyone was, people kept mentioning it and talking about it. So I thought I would get a book. So I bought one of John Wilkes's books, and I read it, and I thought, this is interesting. These are the places I'm working. I better go and learn this stuff. Thought was I'll integrate it within my other treatments, and because that's the way I was doing it, I took bits from everything and I was integrating, and I thought that's the way I'll do it. So I went and did my original training with John Wilkes, lovely human being, one of the nicest people I've ever met, and soon became aware that actually this is like really doing some amazing stuff. But for me, there was bits missing that I wasn't happy with. And it was like, for me, it was a bit like following protocols was like paint by numbers rather than being a true artist. Maybe that's the only way I can describe it. And because I had a history and assessment and like from my massage skills, had really good palpation skills, I kind of like deviated straight away. Then I did a course with Alistair McLaughlin, The Art of Bowen. Again, really enjoyed it, but the biggest thing I got from that was the freedom to actually walk away from the strict rules that were imposed by original training, and actually the way he talks about it. So that was amazing. So I went, and I from there it kind of grew, and then I became aware of Graham Pennington's work. I contacted him to do his workshop, and unfortunately he had literally left the UK like a week after I emailed him, so I just missed his course. But I ordered his book, and I read it cover to cover within 2 nights. And unlike me to get into textbooks like that, I find them a bit of a slog, and I'm kind of like a dippy inny, dippy outy, get bits of information here and there. But I just completely nailed it. And then pretty much the next day, I was putting into practice what I had read in his book, and it instantly became apparent that this was the way forward. So I went and did the first IOS course with Robert Smith and Matt East. Again, 2 of the most beautiful human beings I've ever met in my life. And I instantly hooked, and I just had an affinity with it and was in it straight away. And from then, I've not looked back. That's the results I get working that way and working with Bowen far outweigh any results I've ever had with any other modality, time and time again, and in super quick time. So yeah, not moving, not changing the way I work. Yeah.
Yeah, brilliant. Thank you. And who would have ever thought that cricket was such a hardcore contact sport as well? So well done for
Repetitive strain sport.
ending up in a good in that way.
Repetitive strain sport. If I was a fast bowler, and if you can imagine
Yeah.
the loads that a fast bowlers put on their spine with heavy impact in front leg and fast torque and rotation and torsion through the spine, yeah, basically multiple stress fractures in my spine.
Yeah, wow. But again, I think one of the things that's really important in some of these journeys that get us to this place is it often takes something that's quite serious to get us to look at real depth in how our bodies are functioning and what we need to do to shift things. So, again, massive credit to you as an individual for working through that as a process. And I think that's something that it is a great inspiration to anybody who's out there struggling with pain, that just because they haven't found a solution yet doesn't mean there isn't one.
100%, 100%. And the so is. I mean, I grew up with my dad telling me, God, I wish I knew now what I knew when I was younger. And I was like, yeah, whatever. And now I'm there. And if I had known now when I was being a competitive cricketer and when I was younger, then it would have been a whole different world, completely different ball game. So yeah, I'm turning it into one of those
Absolutely.
sayings my father told me about.
Brilliant, and there's a good reason why we have that ability. Hindsight is so 2020 for us. So
100%.
tell me a little bit as well. So if anybody kind of heads to your website, the assessment-led bodywork training, it talks about Bowen technique. But if I'm reading it, you're not, in the way that the College of Bowen studies and some of the other colleges of Bowen are very specifically doing Bowen training. Is there a difference in how you're teaching your students and the types of work that you're teaching your students that kind of differentiates it from what I would class as, let's say, a core Bowen or a kind of a more traditional Bowen approach?
100%. Yeah, 100%. So I do not mean to be disrespectful in any way, and I will not be disrespectful in any way. The way Bowen is taught works.
Yeah.
People get really good results. However, there's a better way, in my opinion. And that better way is through assessment and through targeting it rather than a protocol based, standardized based fits all. So rather than treating a symptom and, we try this protocol and then we do this, and then we leave 2 minutes, and we do that, and we leave 2 minutes. and see if that works. And if that doesn't work, then next week try this and then this. And then if that doesn't work, then next week try this and this. So why should we do that? Every individual who lays on the couch is an individual, and their body is different. I can have 10 people in a day, every one of them with sciatica, and every one of them will have a different issue, which throws the body out of sync, which causes the symptom. So for me, the key and the most important thing and the most magic thing about, I believe, what I do and what I teach and what a lot of people do is the removal of treating a symptom. We don't need to treat the symptom. We need to look for the causal factor that leads to a chain of events, which then causes a symptom. Otherwise, it's kind of going back to the way it was when I was massaging. You know, someone comes in with sciatica on their left leg, you spend ages rubbing their left butt and their left sort of lower back because that's where the nerve root comes from. We know that. We know there's a problem there because of the symptom. However, that does not mean it's the causal factor. So we're looking for that causal factor. So what I wanted to do with my training was to remove the standardized approach of protocols and actually start from the ground up with assessment. So the first thing you learn to do is figure out where the problem's coming from. And then once we teach people to figure out where the problem's coming from, we then teach them a toolbox of tools. So basically all the different Bowen moves and procedures, and then how to apply those tools to effect a change to target their primary issue, their primary dysfunction, the causal factor. So that is the big difference from the standard sort of Bowen teaching methods, which is a protocol based, you know, you do the BRMs and you leave 2 minutes. I also, from watching Romney Smeaton, who I'm sure you're aware of, work, and watching Graham Pennington work and other people, became very aware of the gaps. Now, the gaps in my eyes are not a standardized thing that you have to do after every little thing. For me, it's about when you have found an area that needs to respond to your input, that's when you give a gap. So if you have an area that is really tight and needs to release, you do some moves over on it, which stimulates the neurological system around it to tell it to change, then you back off. That allows the body to change and the tissues to change, and then you can go back and you can reassess and see how it is. So that is how I'm really trying to structure the course, to totally move away from the protocols, which is why I've kind of called it bodywork, because what I noticed with a lot of people, I'm really trying to aim my training at kind of like high level sports massage therapists and physios and osteopaths and things like that, to try and bring them into the Bowen world, to make it more inclusive, to almost increase the standard of our profession, because I want it to be better and better and better. And I found that for a lot of them, Bowen was a bad word. It was almost slightly taboo because, you know, they'd had a couple of sessions with someone and it didn't really work and didn't really do anything and didn't really seem to know what they were doing, you know. And then so people were kind of like, oh, I don't know. So hence kind of like calling it bodywork. It is Bowen technique and it is bodywork. It is both the same. But I'm just almost trying to rebrand what I do, because my target audience, I'm going for a much more clinical, scientific base, because that is the way I believe the treatment should progress and the treatment should go. And I have, like, at the moment, I'm doing a training course doing a couple running at the moment. I'm in Kent at the moment, but I'm also doing one up in the Midlands. And in the Midlands, you know, the girls that are on the course, you know, they were working in like high level sort of professional football clubs or in those environments, and they're working with really like world championship contender boxers and sort of like premiership and championship footballers, and they're working with these really high level athletes, and they've come to this work, and the results they're getting is blowing these people out of the water, and they're so taken with it that it's amazing and it's good to see. And yet, you know, it's it's basically the reason to change the name is marketing, to try and bring more people into the fold.
Yeah, and I think, all credit for that as well. As you say, a lot of respect to all of the teachers who have brought Bowen up. I mean, when we think about Tom Bowen, who never actually really taught it, and so everybody's had to kind of produce a way of transmitting some of that information in a format that can be digested by those that are coming along to the courses. So,
Exactly.
so we have a strange beginning within this process, and having that, as you like, formulaic pattern gave us an initial framework. And one of the things I know from having already spoken to Michael Nixon Levy, Graham Pennington, Ron Phelan, is that as time went on, they all realized there were problems with certain aspects of how they'd learned things, and they had to evolve the process to get it to work more practically for more people within the clinic and within the teaching.
Yeah. And if you think of Tom Bowen, if we go back to Tom Bowen again, so the guy saw, from what I hear, about 60 people a day. So there is no way you can see 60 people a day doing an hour-long treatment with like gaps after every other move, And then when I was speaking to the likes of, Graham Pennington, Romney Smeaton, people like this, you speak to them, and it's like, 7 minutes was his like average treatment time. Occasionally it'd be shorter, occasionally you'd have to do longer ones, but everything was individual. But it was around about 7 minutes. And basically, as you are probably aware, if somebody has a car accident and there are witnesses who watch it, yeah, and the police go around and they take witness statements, they'll get like 10 completely different accounts of what has happened. Now, the same happens when you're observing someone working, Tom Bowen working. I mean, the difference from doing a move in one place and being like a centimetre down and doing it in another thing, it could look like the same thing, but actually it isn't. And that's one thing I really am passionate about in the course, and I really, really sort of like push forward, is palpation of the tissues and understanding where epicenters of tension are and where you have to put in a move that activates the neurological response that releases these epicenters of tension. Not that like, oh, you do a move at L4. Well, it's around about L4, but let's palpate up, let's palpate down, find where the epicenter of tension is and release there. It could be 2 centimeters below L4, it could be slightly above. And that's the same with every single move, whether it's, the work on the shoulders, work on the necks, the work on the scalene. Anything, it's about palpation and being really present in the body, feeling everything through your fingers and going, that's where the problem is, that's the tight bit, that's the bit that release. Not like you must only do it here, do it once and don't ever go back and touch it again, and then you need to go back. So once you've worked on the body, you need to go back again to feel it again, to see that the tissues have responded. Otherwise, how do you know what you're doing is working? If you don't go back and repalpate, how do you know you've released the tissues? We need this confirmation. You need to teach that confirmation. And that's what I try and teach, is the ability and the permission, if you wish, to go back to areas to see how things have changed. But most importantly, to really feel where the issues are. So when you go back, you can feel and go, oh my gosh, right, that psoas has totally changed. That QL has completely changed. The tension in the neck is totally different. I can feel the alignment in the neck. And yeah, that C2 that was over here has now gone back to where it should be. And it's that understanding of what you're feeling rather than just like putting your hands on, quickly doing it and walking away, that I am really so passionate about. And that's probably about 80% of my course, is almost like getting people to really slow down, to touch, to feel. You training the massage therapists and they're like straight in, and they have amazing palpation skills, but they also don't, because I was the same as well, is that to have really good palpation skills, you have to be so gentle. You hardly touch the body, because as soon as you push and you touch the body, you move everything underneath your fingers. And if you moved it under your fingers, you can't feel what's going on because you moved it. So it's almost like the resting and the feeling of the tissues. And I'm getting a bit excited now, which is slightly worrying. But I'm so passionate about it, and I love to feel the way bodies are and the way the bodies change. It blows me away, and it's amazing how one little simple move and one little simple activation of a nerve in the correct place just has this cascade effect that runs all the way through the body and can completely change so much. I mean, people often ask me, about doing massage and stuff, and I'll generally say, I reckon I can do in about 5 minutes in Bowen, which would take me about 3.5 hours to do a massage. It's
Yeah.
that powerful, and the biggest thrill that you get as a teacher, or the biggest thrill I get, is when I go into the class and you get the feedback that the students have had. Because
Mm.
I love fixing people. It's just like, my clinic's really busy. I get really good results, and, you really love it. But that doesn't actually compare. And I never thought that would be a thing, but it doesn't compare to when, Jerry, who's on my course, comes in and says, "Oh, Phil, I treated this person I've been treating for 15 years. I gave them one session, and oh my God, it's completely changed them. They're different people." And it's wonderful to hear these stories and these feedbacks. And I truly think that is absolutely phenomenal therapy, and it should be bigger than it is. And that is a
Yeah.
real issue. And there's a real issue, and I'm not sure why, but it's now become my passion and my mission to get it out there to as many people as possible, and to really try and get it into those sort of away from like maybe the normal Bowen demographic that we have, and really try and push it into the more young, vibrant, sort of like sports injury massage professionals, the people who really want to fix people, because this works, and it
Mm.
blows a lot of modalities out of the water.
Yeah, and I actually really appreciate hearing all this passion as well. I think part of what part of what the industry needs is people who have this desire for what they're doing and their expression for what they're doing, so that as we're transmitting it, it's actually making a big difference. I mean, one of the interviews I've done in this series for people that watch back through the BPA files with Colin and Joe from the CBS, and Colin was sharing with me that he'd been teaching that weekend up in Scotland, and there was a young lady who was on the course that last year. So one of the things I do every summer is I go to a bunch of festivals and I do Bowen, and I'll run 2 couches, and I typically do kind of 80 plus treatments over the weekend. And
Yeah.
for me, they're really honing on palpation. I just have to very quickly assess, learn, practice, and see those changes in a very short period of time with people. And this young lady had come and had a session with me last summer and had gone away from it so blown away that she wanted to go and train, and kind of
Love
that was the career basis for her to move forward. But and I think it's really important what you're saying as well about that sensitivity within palpation, and how with awareness as we go into that tissue, that we can change it just literally from putting hands on. And this is something I remember being taught, kind of 15 years ago or more, by Dr. Jimmy Scott, who's the founder of health kinesiology, which was the one of the first modalities I started working with. And in some of his body bioenergetics work, that literally just placing a hand in an area, or finger pressure, and just lightly holding that there, sometimes not even moving, was enough to create systemic changes within a system. So I think
Yeah.
it's really important that we're actually talking about that responsiveness of a body, and learning to be sensitive to the changes that are being made there.
Mm. Yeah. No.
So tell me, yeah, go on.
No. Keep going.
So yeah, so I was going to say as well. So obviously you're seeing. I'm guessing that you're also seeing students who have not done body work before, as well as those who have trained in other modalities of body work and are coming to you to kind of develop that. So what do you find is the hardest concept for them to grasp? What's the thing that you find that you have to really drill down into and repeat for people so that they understand it?
That's a really good question. I think the hardest thing I have to deal with is other Bowen practitioners who come on the course.
Tell me more.
Honestly, just totally and utterly stifled by dogma, stigma, rules. Can't do that. I haven't done that. Completely. Oh, what do you mean you want to do the coccyx and the TMJ in one treatment? You can't do that. The head will explode. You know, that is the hardest thing. Is I've actually had quite a few bone therapists who I've never marketed it to bone therapists once, because I kind of think that if you're a bone therapist, you can go and do IOS with Robert and Matt, and you're going to learn the assessment stuff, and you're going to learn the way that I teach. And you don't have to basically pay for a 10-day diploma course. You can do that in a weekend. But what a lot of them have done is they've come because basically it's lacking in palpation skills and the precision of the moves, and I think that being super precise with the moves is so important. Having the palpation skills is so important. And I honestly find that when you're starting with, an osteopath or a massage therapist, they're kind of like, okay, so I'm into this. Okay, I understand the concept. I understand what you're doing. And the amount of times I'll literally, I'll get their hands and I'll put their hands and say, you feel this, and then you feel difference here and feel blah, blah, blah. And then we do the move like this. You feel how it moves and how it rolls. Okay. I find it's almost easier on the blank canvas and the blank slate, rather than with some bone therapists. And I've trained some absolutely, lovely. I've been so lucky. Everyone I've met and everyone who's been on the course has been great. Almost every group you have, you think, God, I couldn't get a better group than this. And then the next group, they're absolutely lovely again. And, just met some of the most beautiful people. But it's almost like, okay, I need to raise the blackboard before we can start again. So you spend a lot of time to say, no, you don't have to do it like this. Do it like this. Feel like this. Why? I can go back. Yes, you can go back. You can do it again. It won't matter. But you said I can. You say I don't have to do that. I don't understand why I don't have to do that. And so breaking that down. So that's probably the hardest thing to deal with. I actually find most other therapists, they're really eager, and what the hardest thing for them is the concept of not treating where the pain is, and like teaching the interconnective nature of the body and the tensegral nature of the body, and then understanding it. But once they get it, literally, you spend that for me, that's like day one, module one, like talking about all that, and kind of you can see pennies dropping. It's like, oh my God, that's okay. And then you go through the assessment, you show the assessment works. Oh, all right, it makes sense. And then as you work, it all makes sense, and they're quite ready to adapt it and go for it. So yeah, I hope that answers the question a bit. But
Yeah, absolutely.
Normal therapists, I feel fine with it.
Yeah. So what have you noticed as being that biggest insight that your students are getting from the way you're teaching as well?
Ask, don't tell.
Yeah, sure.
Basically, you're asking the body to change, you're not telling it to change. Constantly,
Yeah.
and by that, you are calm, you are relaxed. Your hands are relaxed, your shoulders are relaxed. And if you are relaxed, you can feel. If you are tense and you're holding up and you're forcing pressure, you can't feel. Yeah. And if you're like that, you're trying to force a change and make the body change rather than be relaxed. Be basically just asking the body to change with every move you make. You're really focused and conscious on exactly the precise area that you are touching, that you are palpating, and you are asking the body to change. You are not telling it to, you are asking it to. And the body wants to be healthy, and it doesn't take a lot of asking for it to like go, yep, I want to change. Thank you very much.
Yeah, beautiful. It's funny because for years I've used this analogy of it being an invitation, and that as a way of framing that to say, if you were going to help somebody who had limited ability to cross a road, you can go up and you can grab their arm and you can pull them, but they're going to resist. Whereas
Yeah,
if you go up and hold your hand out and offer them an invitation and they take it willingly, it's much easier.
perfect,
I
beautiful.
think for me that's a lot of what Bowen is. It's about having a sense of presence as well within ourselves, and it's one of the reasons why for myself, my qigong practice is a real key part of what helps me to be a good practitioner, because it allows me to be much more aware of me and understand how my posture is affecting me, how my breath is affecting me. So all of these aspects that I can then regulate and change, that because you're then entering into relationship with the person that you're working with, you're much more likely to have a healthy relationship with them, and therefore the outcomes are likely to be better.
Yeah, yeah. And for a sort of like a high intent, sort of a high quality sort of sporting metaphor, you hear about the one percenters, and basically for me, the way I train and the way I practice is all about the one percenters. Is I will
Mm.
go to an area and I won't do a move. I just let my hands be there, move around a little bit, find where take my time before I do the move.
Mm.
That makes so everything is slowed down, and I'm making sure that I am. It's almost like you hone in on the target area, and then you have to find the bullseye in
Mm-hmm.
every single move that you do, whether it's in any move on the body, any input you're putting on the body. You want it to be as precise as possible, and the more precise it is, and the more targeted it is, the more effect it has. And all these
Mm.
little 1% build up through the body, and then suddenly you're taking 2 treatments to create a change you would have taken 4 or 5. Just because everything is so focused and so targeted. And I love all the stuff with your breath. I'm very focused. Like when I'm working, I generally keep my mouth shut, which makes me nose breathe and keeps me calm. And yeah, there's lots of little things that I want to integrate into my training, but the most important thing is the ability to listen to the body, to hear what the body says via palpation, via assessment protocols, and then to, again, really just ask it in the most precise, delicate manner that you possibly can to change. And when I say
Mm.
delicate, I use quite a bit of pressure sometimes, and people
Mm-hmm.
often wince because I think it's because I try to be as precise as possible. So I want to find the exact epicenter of the problem. So it's going to be tender because I've got it bang on the head. So I'm not that delicate. Yeah, delicate as in is in mindset rather than touch.
Yeah, sure. And I myself, I've had some treatments where it feels a little bit like you're just getting the book of techniques thrown at you, that they're
Um,
not really sure what they're trying to achieve. So it's kind of like if we throw the lot in, then, we'll get somewhere. But really, what you're advocating is do less work really well so that you get far more benefit out of that.
yeah, and also have a really clear sort of scientific understanding as to why we're doing what. Because I mean, um, I studied cell and molecular biology for my degree, so I have this science monkey on my head, as well as kind of like the holistic hippie kind of sort of monkey as well. So I have this like holistic sort of view of the world whilst having this scientific critique of it as well. And it's really important to put the two together, and that's what
Yeah.
I really try to do within the course. Like Graham would have said, talking about the dura mater, talking about sort of like the myodural bridges and how that affects the central nervous system, and how a restriction to the central nervous system affects the tissue, and then how that tissue tension affects the skeletal alignment, and how that skeletal alignment chucks us out and gives us pain. It's going back, everything within this treatment goes back to the nub of the cause of everything, which is a disturbance of the central nervous system and a dysfunction within the central nervous system. And the central nervous system governs everything. And when you're disturbing that, you create chaos within the body. So everything is going back to hopefully point one of where it's all starting from, which is why I think you get such powerful and good changes where many modalities don't.
Mm.
I'm
Yeah,
sure you've,
beautiful.
across the amount of times, I'm sure you've treated someone, with, I don't know, let's just say raging sciatica, and they've had, physio, massage, God knows what, and it's all been bottom of the back, sort of L4, sacrum, loads in the glutes, piriformis, your hamstrings are weak. They tell them all that stuff. And along we come, flick them in the neck a few times, and it's like, oh, they're better. And it's just magic. It's magic. If you know where to
Yeah.
look, it's so much easier.
Yeah. I mean, I love the fact that you have that biochemistry aspect in there as well. One of the things that I found invaluable over my years is within the kinesiology. I've done a lot of work within epigenetics and functional biochemistry, and sometimes it's understanding what that actual biochemistry issue is underneath, so that as you support that as well, you get that change in the tissue. That if you're just focusing, as you say, chasing the pain and going for the obvious stuff, you sometimes miss that.
Yeah.
So I'm kind of curious as well, what for you, what's really changed over time in the way you practice? What's become really important to you now that you kind of never envisaged, when we go back? I mean, this is a 30-year career for you, so
Yeah.
what's that big kind of shift in your learning?
I don't know. Never stop learning. I think that's the really
Yeah.
important thing. Never stop learning. Every patient, every client that lies on the table generally teaches me a lesson. I don't really have a day in clinic when I don't pick up something new and learn something new. I mean, I'm working on some new stuff at the moment, which I've been working on, and it's completely blown me away and knocked my socks off of like how I can sort of change tension within the sort of central nervous system, but particularly within tension of spinal segments, and just working on individual spinal segments. And I demonstrated it in my last course, and to see and feel the change of the tissues in people just with this new work I've kind of added in is just completely knocked my socks off. And so this is something that I'm in the process of learning. I'm in the process of experimenting. I'm in the process of discovering myself. And I think it's really important that people aren't shut off, because I can put my hand on my heart and from the bottom of my heart tell you that when I was a massage therapist, I knew what I was doing and I didn't need anyone else to tell me. And that was it. And I was bloody good at what I did. And I was a good massage therapist. I was fully booked for like 6-7 months in advance, flat out all the time. And now I look back and I'm like, God, you were only scratching the surface, and to have the willingness and the ability to listen to others, to learn from everybody you meet. I mean, I've been lucky enough to come across some amazing people in my life and some wonderful sort of teachers and mentors. And I'm going to mention Graham Pennington, because without him I wouldn't be here. Going to his place in Australia, he welcomed me so much, and he just like by watching him work. I'd already done a couple of courses with him, but watching him work, seeing him in his clinic, or just like sitting in his house having a glass of wine and chatting about stuff, just like completely opened my eyes. And then he was the one who poked the bear and said, look, you've got to go and sort of teach this. But having people like that and just having, what I've noticed is a lot of people are very blinkered and they believe what they do is best and that's it, which is lovely, but it's also self-limiting. Sometimes you need to take the blinkers off. Like if I could talk about when I went and did the advanced manipulative therapy course. So it was a 2-year course. It was bloody hard work. It was incredible detail. It was one of the finest courses I ever did, and it taught me I didn't want to do it.
Sure.
Yeah. I came out of it,
and sometimes you need that.
Exactly. I learned all this stuff and it was amazing. And that knowledge is still there and it still helps me to the day. But I also discovered that I didn't want to do that and I didn't want to work that way. So sometimes you have to kind of go one way to realize you need to go another way. And And that's the thing that I suppose is the trickiest thing within the marketing of the course to sort of sports massage therapists is they're like, what? But you hardly touch anyone. How are you going to make the difference? No, you need to get in there. You need to really work the hamstrings. You need to really do this. You just do that. I mean, that's not going to do anything until they actually have a good treatment, or until they have experienced it, and then when they try it and they see the results, then they absolutely blown away, and they go, oh my god, I've been working so hard for so long, and all I have to do is do a few little flicks in the right place and I'm good.
Yeah, no, I love it. I mean, I can remember back, I've been in professional practice for over 21 years now, and I can remember back at maybe about 2-3 years in thinking, wow, I know so much, there's so much I can do. And these days I'm completely the opposite. It's kind of like, there's so much I don't know, and there's so many more layers that we could look at and things we could bring in. It's always fascinating.
And I think it's really, I mean, it's really important to evolve and grow as a person and as a human being and as a practice, which I think is what, I really commend you for what you're doing now. Is Bowen is fractured and splintered with politics and nonsense, and to have these wonderful talks you're doing with all the different people from different schools, and try and sort of amalgamate them into one. It's so good, because we need to be together and we need to try and take this forward, but we need to grow. We have to understand that what was, and if you look at the evolution of bone therapy, so most of it comes from obviously the observations of Ozzy, and then you have to think Ozzy observed from here to here, and then like Romney was quite a few years later watching him, and what was the difference in Tom's work over those sort of like 10 years? How much it had changed? I bet you it changed loads. So the thing is, we don't know. And then people like Graham Pennington come along and add their insights. The Ron Phelans, Alistair McLaughlin's, there's all these amazing people like Milton Albrecht, all these wonderful therapists come along, and they add their little twists to it, and we should allow it to grow. We shouldn't go, no, that's not the way it was, because that's what was. This is now. Let's just grow and let things progress and change and evolve, maybe of evolution. Ross Emmett, here's the other one I was thinking of. All these little people, these are huge, amazing therapists, and we shouldn't remove their input into what is an amazing, amazing treatment. Because if Tom Bowen lived forever and he hadn't died, I bet his treatment now would be completely different to what it was when Ozzy Wrench was watching him. And we need to move away from this stigma that no, that's the way it was because that's the way Mr. Bowen did it. What he left us was an amazing legacy, and cannot thank him enough. But he learnt it from someone. He learnt it from Ernie Saunders, and it could have been sort of he went and learnt it from there, and then he progressed and he made it his. So he basically took something and made it better, and then other people have now taken that and hopefully made it better. I don't know. That's just the way I see it.
Well, I think it's the way to go. And, for the last nearly 15 years now, I've been working with a philosophical model called Integral, which works in an amazing way. But there's a couple of really interesting parts of it. The first is we see everything as what we call holons, which is whole parts, which means that everything is complete within itself, but it's partial to a greater whole. So, and one of the guy who developed it, Ken Wilber, one of the things that he always says is nothing is 100% wrong. There's value in everything if we know where it's to be applied. And we recognize what we class as developmental levels within there. So what we're really talking about here is the fact that we've got stuff that's going through evolutionary shift. And, the generation that come in, when we're old and past it, are going to look at our work and they're going to take it other levels. And so to have this real cohesion of sharing and being open and having insight without needing to negate anything that anybody else is doing, but just saying, well, here's another perspective, here's another way of looking at this work. And that in itself then contributes to the whole corpus of what we're doing within bodywork, within physical therapy. And that includes people from chiropractic, osteopathic, physiotherapy, from all these other disciplines, positional release, however you want to look at them. We've all got gems that we've had insights into, that as we bring them together, in integral, as we go through a change in a developmental level, we do something called transcend and include. So we transcend the limitations of a previous level while including all of the value from the previous level. So it's never a total binning of everything that comes before, but just which are the gold in there that we can then go forward and increase further as well.
Yeah, love it. Like separating the wheat from the chaff. This is the little nuggets we've learned, and this is the stuff we don't need anymore. Yeah.
Yeah.
I
So
always,
what do you wish? Sorry, go on.
no. I just about to say my, because obviously I have the clinic I have is multidiscipline. So like I've got an amazing physio in there, some really good sports massage therapists, and some really good sort of like intuitive therapists and acupuncturists. And I always think, is like people always phone up and go, oh, my back hurts. What do I need? I mean, how can you answer that? I mean, it's like, all different ways to skin a cat. So my analogy is a bit like it is a spider's web, whereas the middle of the spider's web is the goal of good health. But the way we can get there, if you trace your roots, you can go all over the place. And there's different paths to get to that place, and sometimes you need little bits of different things, and sometimes one will go straight into the middle and sort it out. So, yeah.
Yeah. And is there anything that you wish you'd been taught when you started on this journey that's become fundamental to the way you work now?
That's a tricky question, because yes, but I've been taught most of it and I've learned a lot of it.
Yeah.
So yeah, there was loads of stuff that I mean, basically what I really wish that, or what I was lucky enough to develop at a very early time that I was never taught, was to calm, to feel, and to have an intrinsic. I don't know. I think I'm quite lucky the way my brain works, because I think about the body very differently to a lot of people. And I just thought it was me, and I just stood in the classroom and, yeah, but it's obvious, isn't it? This leads to that, and then because of that, and then you get that, and then that, and they're like, huh? And I think I was lucky to be able to see a holistic view of the body from right at the beginning, and to basically really, like, even when I was doing massage, I would start with the client on the couch covered in a towel, and just really gently feel everything and understand. I could literally almost close my eyes and picture where all the lines of tension were and how they pulled in one place and the other, and where it was restricted to pull here. So I would often, be work on someone's sort of like neck or shoulder to do with the lower back, because they come in from a lower back problem. And I think I was lucky, or maybe it was just a gift, or a sort of intuitive understanding of that. But I do wish I was just taught just to shut my eyes and to feel. I mean, and that's what I really try and get people to do, is to shut their eyes and to feel, and to delicately touch, and to touch with a whole hand, not poke with fingers. A lot of people, they palpate, they're like this, what's going on? But the reality is, you need a whole applicator. If you put a big surface area, you can feel what's going on under your hand. If you put a little surface area, you can only feel what's going on under a finger. So if you have like a muscle with a say this is a tight segment of your muscle, if you're going in like this, you're missing it. But if you put your hand on, you can feel all the tissue around it, and then it's easy to differentiate that area of restriction within that tissue. So it's that real gentle touch all over the body, and just feeling almost the muscles pushing back against you, not you pushing into the muscles, because you don't want to disturb what you want to feel, because if you disturb, you're interfering. If you're interfering, you can't feel. Does that make sense? Yeah.
Yeah,
Good,
beautiful.
you're nodding, so fingers crossed it does. I mean, and so if there was anything that I wish somebody had taught me, it was just like stop and feel before you start. But
Mhm.
as I said, I was lucky that that almost was intuitive from the day dot.
Yeah, fabulous. Now, one of the things that in kind of looking at some of your work, I know on the College of Bowen studies in their CPD, your fine tuning the neck course is in there, and I know you're running that through the UK at various points this year. But tell us a little bit about, so for me as a Bowen practitioner, kinesiologist, and so on, what is it that you're going to put into that time that you think would be of value for me to learn and hear about?
So I think it's one of the most um, important courses anyone can do. I don't mean that to like blow my own trumpet or anything. It's not like that. But basically, the reason is because the neck is so important to people. Yeah, the neck is such a key driver to holistic dysfunction, and quite often the restrictions within the neck cause global restrictions and global issues all the way through the body. So it's really important to understand it and to understand the interconnected natures within the neck. And when I mean the neck, I kind of mean the fine tuning of the neck is kind of from like across here all the way
Hmm.
up around. So you're involving the jaw as well as the neck. You're involving the shoulders because you can do a lot of shoulder stimulation and a lot of neurostims from around the chest that go up into the neck and release the neck. So it's kind of like the upper, I don't know, fifth of the body, so to speak. Um, but it's again, I'm just going to sound like a broken record, Ben. You're going to be really bored. It's palpation, it's feeling. It's literally there was I don't know who it was, and it wasn't me, but I wish it was. But it was a famous body worker. Somebody did tell me her name, and I have forgotten. But she said working on the neck is like visiting a big library. The first thing you have to do is you walk in the door, and then you have to find the section of books that you want. And you go to that section, and then you have to find the row of books that you want, and then you have to find the shelf, and then you have to find the section within that shelf, and then you have to find the book, then you have to find the chapter, then you have to find the page, then you have to find the line. And that's like it with the neck. You feel all the restriction and tension as you're working on it, and then you need to go finer and finer to like work on the epicenters of restrictions, particularly like of the scalenes and the suboccipitals. I mean, the suboccipitals muscles are so important, and they need more than just a couple of little moves at the beginning of the neck
Mm.
procedure. They need more than that. Yeah, and they demand more than that, particularly if there's dysfunction. But again, a lot of people just do the moves. They don't have, oh, that's dysfunctional and that's not. One thing I wish I was taught with in Bowen, actually, going back to your last question, is that when you did a bad move, it wasn't because you're a bad therapist, which nobody ever told me. It's like you do a move and you get a nice twang. Okay.
Mhm.
Oh God, and then like you do it, and one person, next person, you can't do it. It's like, oh my God, what am I doing wrong? You're doing nothing wrong. What it is the tissue is dysfunctional. There's something wrong with
Yeah.
the tissue, so you can't get a good move. And why did nobody tell me that? Yeah, nobody said, well, actually, it doesn't feel good because it's not good, and you need to work on it more. That was one thing I wish I'd been taught actually. But the same, like going to the neck and really understanding where is dysfunctional and where you have to put the input in to get it to change. Sit back, let it change. We give it input and then we give it time and space to let it change, and then we go back and we do more. But for me, it's very precise palpation along the scalenes to release very precise areas of the scalenes to look at the pterygoids and their relationship with, because I believe that the jaw work should be much more pterygoid based and not joint capsule based, and to
Hmm.
look at the relationship with that and like the sternocleidomastoids, because there's like relationships, and if you could work on a really sort of like hypertonic sternocleidomastoid for ages and not get a release, because actually the primary driver could be the the pterygoid on the other side. So it's looking at that. It's working on those little restrictions within the scalenes that causes subluxations within the spinal column. It's then looking at the shoulders and how the shoulder stabilization. So the the Robert Myers anatomy trains. So if you think of those, like the anatomy train that goes up your arm, wraps around your back and your front, and goes up into your neck. Yeah. So you can actually do a lot of work on the shoulder that helps release this tissue into the neck. And then there's other neurostims you can do on your back and on here to work on like subclavicular nerves, which then go up and they go up through the brachial plexus up into like C2, C3, and you can release the neck through working on these areas. So it's just like a really key thing, and it's something that any bone therapist can incorporate into their work. But the most important thing is, and the feedback I get constantly, is that it's completely changed everyone's practice, not because of what it is and it's great, but just because I'm just saying stop and feel. And we're going back to the palpation argument all over again. And I do think that's one thing that it's really, really hard to teach. So maybe that's why it's not taught so much. You know, it's bloody hard to sit there and to teach people to really feel. And yeah, it's so rewarding, and to see like people's light bulb moments when they start, oh my God, that's it. And I often say it's like a radio. Well, obviously radios when we were kids, not these days when they're dabs. But you know, you know when you had to turn the dial to tune in. Yeah. And then you get it. And it's like that. It's like, you know, you don't really know what you're feeling. And then once you felt it, you've tuned into it and you know what to feel. And then it's easier to feel next time, and so on and so on. Yeah. So the more you do it, the more you palpate and the more you feel and the more you understand what you feel, the more you recognize it. And then the more you recognize it, the easier it is to find it. And then before you know it, you know, you put your hands, you know, I'm getting quite good now. Still not up to the level of a lot of therapists, but I'm getting there. And for me, like I can pretty much do a whole body in less than 10 minutes, you know, not a problem at all. And to feel and palpate is super easy, but it wasn't. And like I've got a guy on my course who, he says, repetition is the mother of mastery. And if anything that really rings true, it's in Bowen. It's just like doing it over and over again. And anything in life that you're any good at one time you were rubbish at it. Yes, maybe with your qigong or Fred's golf. You know, when he started playing golf, he was hacking the ball here, there, and everywhere. And 10 years later, he's booming it down the middle of the fairway. You know, it's sometimes we have to start again to get better.
Yeah, no, I totally agree. And I think we should probably just put a little note in here for the millennials that there used to be this thing called a radio dial that you had to manually adjust to find exactly the right signal. And, you know, if you moved or you knocked anything, you had to do it again. There wasn't any of this auto search digital stuff, you know, back when we were lads. And I mean,
called the radio.
Yeah, sure. The charts on the Sunday nights and stuff like that. I mean, I love the way you're talking about the neck in this, and you know, like you, I've moved away from working joint capsules down to pterygoids, and just those relationships within the neck. That there's so much richness in there, but again, it just takes that time, and I don't think it's anything that you can ever truly convey the value in time. And you know, and I said this with Michael Nixon Livy and with Graham Pennington, that just by the time you've done 10,000 hours, 20,000 hours of palpation and touch and work with bodies, what you're receiving as information through your hands, you just can't even, you couldn't even have conceived of that when you first began. And developing those skills over time is really really tricky. And I'm kind of I'm intrigued as well, because you were talking earlier about kind of that biochemistry, the importance of the scientific side of it, and obviously Graham Pennington's work has been a big influence in how you're working. And obviously Graham's really and he's obviously really interested in the acupuncture side of things as well. So what do you see as that relationship into the meridians, the acupuncture side of things? How does that figure within your work?
I would say in a very rudimentary way compared to like Penno, who has such a deep and thorough understanding of it. Mine is much more. It's it's just enough knowledge to be dangerous, really. So I look at I understand it. I know it's there. There are certain aspects that I get, and there's certain aspects that I don't get. So with the Ayurvedic massage, for instance, there's lots of marmas, and they're like energy points within the body, and a lot of the Bowen moves are correspondent to the marmas as well, and then the marmas are also correspondent to a lot of the acupuncture points. So there's kind of this overlap. I definitely use the kidney work a lot to manipulate the chi from the seat of the kidneys where the chi is held. I kind of look at it as like it's a dam that has the chi in, and when you do the kidney work, you open the sluice gates that allows a rush of this energy to flood into the body and into the meridians, and basically pass through the meridians to help energize the body, tonify the body, to basically get everything balanced again. And then it's important to close the sluice gates so you don't drain your reserves, so to speak. I also know that like the psoas work is really important with the Chong meridian, which again really important with sort of digestive work and reproductive work as well. There are certain different other, literally there's so many different points, like when you do the bottom of the foot and you're on kidney 1 and how that affects the body. So I have a rudimentary awareness of it, but not just enough knowledge that it really makes sense. But my teaching is much more structural. So more, I do involve that into an aspect, but it's much more of a structural base of like a musculoskeletal functional base. The work I'm developing at the moment is a lot of work up the spinal cord, and basically feeling and activating the flow of the cerebral spinal fluid, so it almost feels like a wave going up and down the spinal cord, and that I know that obviously corresponds with the governing meridian, and that the governing vessel, and that's so the vessels within in Chinese medicine, they call the vessels, they're like estuaries full of chi, so great big channels full of chi. And yet like kidney meridians and all your meridians that we have usually have your acupuncture on and stuff, and what people are more aware of, they're more like little tributaries, so they have less in. So basically when you're working on these big vessels, you're actually creating a really big change. And what I've noted is that
thanks, Phil. Listening to Jimmy Carr just recently said it's really important we all have imposter syndrome. So it's good that there's a part of you that has that humility. I love that as well. But we'll talk about that another day. But thank you to everyone who's given their time and attention to listening in to myself, Ben Calder, and Phil Steward here for the BTPA today. And if you want to learn more, please do go and check out all our websites. All the links will be in the video description below. And look after yourself, stay healthy, and thanks for your time and attention.
You can find areas of the spine that don't want to move, and after I've done my treatment and I have achieved symmetry and I know the dural restrictions have been resolved, then I can go up and down the spine and I can introduce little sort of impulses through different areas of the spine, and you can literally feel it move under my hands, and you can feel those it's like it doesn't want to move, it doesn't want to move, it doesn't want to move, and then it goes. And then as it goes, that restriction under that area so it just dissipates, and you can feel the restriction in the spine going. The spine starts moving as they breathe, and it's fascinating. I love it. And to actually feel the way that the tensions in people's necks change, the tensions in people's sacrums, lower backs just completely melt. It's kind of like a little add-on to the treatment, but I think it's something that I'm definitely going to work on and look to, hopefully sort of share with people, because we started messing around with it in the course in Coventry, and we got like everyone doing it, and everyone was like, oh my God, I can't believe this. You can feel it. So there was like a little bit of like, because I was like, well, you know, I'm working on it. I don't know if I want to tell anyone about it. You know, I haven't quite sorted it out myself. But then, to be perfectly honest, the people in the course at Coventry just literally pulled it out of me. I didn't have a choice. And yeah, things happen for a reason, I suppose.
Always, absolutely. And again, it's these little insights that over time we kind of build into bigger and bigger pictures. I mean, the first time that my qigong teacher showed me the diagrams for what are called the fascia sinew channels, and
Yeah.
these are the
Well,
ancient
yes.
channels that the Chinese worked out. And then you look back at like Tom Myers' work and so on, and you think, okay,
Pretty much identical,
yeah.
isn't it? Yeah.
Yeah, it's beautiful stuff.
Yeah.
But then again, it's understanding how we can use distal points to affect, the body in so many different ways. It's always really good stuff. Thank you so much for your time today. I know you've had a busy day teaching, you've got a weekend ahead of it as well. So I'm really, really grateful for your time. Now, for anybody that wants to learn more about Phil's work, you can go to his website on assessment-led bodywork training. And that website is ALBT, all lowercase, .co.uk. And we'll put a link to that in the video description. And I know for one that even before you and I had talked today, your fine-tuning the neck had gone onto my CPD list of stuff that I will be attending in the future. So I'll really look forward to seeing you in person, Phil, and getting to feel those hands and learn from you. So thanks for a really fascinating discussion.